Have you ever wondered what it takes to get a great scar? Well, you're not alone. I literally get this question about 10 times a week. It's understandable. If you are planning to undergo plastic surgery, you're probably doing a little bit of research on how to get the best scars possible. And during that research process, you might come across some creams and gels that are marketed specifically for scars. Now, you might be tempted to go ahead and place a small down payment on that expensive cream, but it's important for you to know one seldom mentioned fact. There is no scientific proof they work. There's no proof that these creams are any better than your standard over-the-counter hand cream. Let me repeat that. Scar creams do not have any advantage over standard moisturizing cream. This has been studied for decades by various researchers at reputable institutions. The simple fact is that manufacturers stand to make a fortune off this type of viral marketing. I mean, who doesn't want to purchase the product that will get them the best scar? Scar cream manufacturers are banking on the fact that people will do everything in their power to get a good scar, even if it requires spending a lot of money. But where does that leave you? Maybe with a little peace of mind? Well, I'm here to tell you that you don't need to purchase an expensive cream to get the best scar. The science is clear on this and certainly not new. Scars have a certain cycle of healing that takes several months to complete. Initially, scars will thicken and become more firm during the first month of healing. It's often associated with the worst appearance a scar will have. But scars also need to go through a maturation process before you see their final appearance, and that's a slow process. Instead, let me provide you with a few proven tips that reliably get my patients the best scars. Number one, moisture. Scars that are dry tend to heal poorly. The magic of moisturizing rests more on your diligence to apply the product frequently than it does on any compound within the cream. Number two, sunscreen. It's important to protect scars from becoming dark. Scars mature over the course of 12 to 18 months. During this time, an immature scar can absorb sunlight and darken, but the darkening doesn't always fade. So using sunscreen is an absolute must. Number three, pressure. Immature scars tend to soften and flatten in response to direct pressure. This is as simple as massaging scars gently several times a day for several months. Number four, avoidance of tension. Scars that are subjected to traction or stretch can sometimes widen. This happens less on the face, but can happen in other areas such as the shoulders, thighs, and torso. An experienced surgeon will also avoid excess skin removal that can immediately put tension on an incision. What I recommend to my patients is to continuously tape a scar for several weeks just for this purpose. So the next time you're going down the cream section in your pharmacy, you can skip the scar creams and stick to the simple principles I just laid out. Tap follow for more tips like this.